My name is Ryan Metcalf. I'm Section Chief of Transfusion Medicine at the University of Utah and ARUP Laboratories, and I chair the AABB's Clinical Transfusion Medicine Committee. So the process of developing the new platelet guidelines involved taking all of the evidence about when platelets benefit patients or when they might harm patients and trying to really balance that risk-benefit as much as possible. So we put all of the evidence together, and then we decided how certain we were in the evidence. And from that, we used the evidence to help us decide what to recommend for clinicians. So the guidelines' important messages, these are fairly practice-changing, and the recommendations that we made for the platelet guidelines is to implement restrictive strategies. So it will involve transfusing patients a little bit less to find that optimum of balancing risk and benefit as much as possible for the patient. So that's the main message, using restrictive strategies, and those improve patient outcomes overall by avoiding adverse events, and that's why we wanted to do it. The new guidelines benefit patients by, first of all, we looked at what were the most important outcomes, looking at mortality, looking at bleeding. We transfuse platelets to try to prevent or treat bleeding. And we compared different strategies, and in the absence of using a more aggressive strategy to prevent or treat bleeding or reduce mortality, we would recommend the less aggressive strategy actually to avoid adverse events, which patients care a lot about, and also making sure we have enough platelets available for the patients that are most likely to benefit. So that's the main message of the guidelines. AABB was incredibly helpful in facilitating and advancing the guidelines. We couldn't have done it without their support. Being able to get the group together in person to talk about all the complexities of the evidence was critical, and that wouldn't have been possible without the AABB. They also supported us using the best possible methods to make sure that the guidelines were trustworthy and had the best possibility of benefiting patients. So very grateful for the AABB and their support in creating a high-quality, trustworthy guideline. So as far as takeaways from the conference, there's always new things going on in the field. I think there are many new technologies that we're very interested in. AI is one in particular that I'm quite interested in. And I think there were a lot of interesting sessions trying to approach this and understand the current state of practice and really where the field is going. That combined with seeing friends and colleagues in person is just really what makes this meeting special.